Can a herniated, bulging, or ruptured disc actually heal on its own? Did you go to the doctor, maybe you had an x-ray or an MRI, and they said that one of your discs is herniated or bulging or ruptured, and probably at that point then recommended surgery, and you're wondering, do I have to have surgery? Can this heal on its own? What's the next best step for me? Then today's video is for you. We have so many people who are coming in who have been to see a surgeon who says, yes, there's clearly a herniation, a rupture, bulging. There's all kinds of different words and they're all super scary. And the surgeon says you have to have surgery to fix this because it's not going to heal. So I want to share this story with you because it's super critical. If you have been told this, particularly by a surgeon, I hope you will watch this video to the end because I'm going to share a story that really brings home this point that I literally witnessed with my very own eyes. But if you have been told this and you're wondering what you can do or if this is possible for it to heal on its own, I am here to tell you that yes, your body is able to heal a herniated, ruptured, bulging, whatever word you want to use, disc, as long as everything is moving correctly. But first, let's define some terms. So, what is the difference between a herniation and a rupture or a bulging? So herniation and bulging are very similar in what they're describing. And basically it is you have this disc, which is kind of this kind of shape, and it's bulging out usually on the side a little bit. So if you're suffering with sciatica, it's probably from this bulging disc that's bulging out to the side, or it's herniated out to the side. The important thing here is that all of the discal material is withheld within the borders of the disc. So everything's inside. The best analogy that I've heard is a tube of toothpaste. So if you have a tube of toothpaste, which this is kind of a weird looking tube of toothpaste, right? But if you have a tube of toothpaste and all the toothpaste is inside and the lid is on, that's a herniation or a bulge. That means all the toothpaste is still inside the tube. Now, it is bulging out, so there is some pressure on the side, but the nice thing is that means that the bulge can also decrease. So if it's increased, it can also decrease. What you need to have is the right amount of movement going through that disc to help that bulge be able to decrease. Now, if you have a rupture, what that means is that's kind of like the jelly donut analogy. So you have a jelly donut, right? So now we're at least jelly donut shape. And you have the jelly inside, and you know how like they inject the jelly into one spot. So if you squeeze the jelly donut, the jelly will come out, right? I know, why would you want to do that? You want to bite the jelly donut, but stick with me for this one. So if you squeeze the jelly donut and the jelly spurts out the side, now that's a herniation. Now you have jelly outside of the donut, or toothpaste outside of the tube, or discal material outside of the disc. It's all the same thing, but basically some of the disc is outside of the borders of where it's supposed to be. Now many people say, oh, well, there's no way my body can heal from that, except that it can. So your body actually has ability to reabsorb this discal material. Now, it's not going to go back into the disc. I'm not saying you can put the jelly back in the donut. That's not what's going to happen. But your body can come in and clean up that area and move it out so you don't have that inflammation around there. Your body is also capable of closing or plugging that hole so it doesn't become a problem again. Now, it's going to be scar tissue, which is not going to be 100% as good as the original discal material, but it can definitely make it pain-free, and it can definitely heal so you can get back to doing the activities you love. However, the disc is not going to heal if it's not moving correctly. It's very important that the disc have the proper amount of stress on it in order to be able to heal. Discs are kind of structured like a Chinese finger lock in that they need to have tension and they need to have relaxation on them. That's what helps to bring in all the nutrients as well as flush them out. They're kind of like a sponge. So you squeeze it and everything comes out. You put it under the water and everything comes back in. After the age of 20 years old, we do not have direct blood supply in general to our discs. You may have a little bit more room than that, but generally 20 is the accepted term. And that's just because gravity pushing down on our heads decreases the blood flow over time. So we get our nutrition into our disc through a process called imbibition. That's the sponge analogy. So you squeeze the sponge, the water comes out, you put the sponge under the water goes back into the sponge. That's how discs get their nutrition. That happens through the motion of rotation. So when you're rotating, right, rotating one side, rotating the other side, that's what actually brings in the nutrition to the discs. So rotation is really good for discs, except if things are not moving correctly. If you try to rotate and it's extraordinarily painful, then what's happening is that your joints, your muscles, your ligaments, your tendons, something is not moving correctly. And that's causing pain and stress to the disc, which is what caused your symptoms in the first place, either the herniation, the rupture, which may have led to sciatica pain or numbness and tingling in your hands if it's a herniated disc up in your neck. Now that you understand the difference between a disc herniation and a disc protrusion, you'll know that if you've been to the doctor, often they do not recommend surgery for a bulge or a herniation because they're going to let the body deal with that on its own. However, if you do have a disc protrusion, which means again that discal material is outside of the confines of the disc, chances are very good that the surgeon is going to recommend surgery and is also going to tell you that your body is not capable of dealing with this on its own. And this is where my story comes in. So while I was getting my PhD in orthopedic manual physical therapy, I had to observe 5 different surgeries, and 2 of them were discectomies. So these were people who had that disc protrusion, the discal material was outside of the borders of the disc, and the surgeon was going to go in and remove that discal material so the body could heal the rest of it on its own. Before the first patient came in, he showed me the MRI, which clearly showed a disc protrusion, okay? There was discal material outside of the confines of the disc. I saw it on the MRI. The surgeon showed it to me on the MRI. The surgeon then had the patient lay on the table and cut into the appropriate area. Everything the surgeon did was correct based on the MRI. However, when the surgeon got into that level, there was no discal material there. I am not kidding you, friends. He went up, he went down, he went in, he went out. There was no discal material there. Now, the surgeon was not happy with me because before the surgery, I had asked him, do discs heal? And he said, never. Well, friends, if you've ever met me, you know there's 2 words I don't like to say. One is never and the other one's always. Because never and always are very absolute terms. So when he said never, I got a little concerned because never, you've never seen a lumbar disc heal? Because I've seen them heal. I've seen people move better, I've seen their pain go away, I've seen them return to their functional activities, which to me is all signs of healing. Now I admit, I'm not a surgeon, I don't actually get to cut in and see what's going on, I understand that. But if you get back to all the functional activities you want to do without pain, then I feel like that's the definition of healed. So he said that they never healed. This is what he said based on the MRI before the surgery. So when he gets in there and there's no discal herniation, obviously, in this patient, he looks at me, he says, "What the, did you ask me?" And I cowered in the corner and I said, "Do herniated discs heal?" And then he told me to get out of his operating room, which I couldn't do because it was going across a sterile field, so I was like stuck in my little corner. It was really kind of embarrassing. Now you may say to yourself, well, that's not a good surgeon, you know, he did something wrong. He didn't do anything wrong. He had an MRI that showed a disc herniation. He cut into the correct area in the patient. The only thing that he did not take into consideration is the fact that that MRI was 3 weeks old. 3 weeks. So in 3 weeks, this patient went from a pretty significant disc herniation. I'm not kidding you. I mean, I saw it. It was significant to no disc herniation in 3 weeks. So I have literally seen the body's ability, literally with my own eyes, in an operating room, ability to heal a disc herniation. Now, Why do most surgeons not talk about this or see this? Because often surgery is scheduled within a week of the MRI, and it takes longer than a week for your body to heal. So had that patient had surgery within the first week of the MRI, I feel pretty confident that the doctor would have found some discal material in there. I think it was only because of the 3 weeks that the patient had to heal their body naturally. But the point of the story is that this patient did not need surgery. So, what if you waited 3 weeks? What if you waited to see what happened over the next 3 weeks with your symptoms, and then you decided if you wanted to have the surgery? Could you wait 3 weeks? Now, I understand some people cannot wait 3 weeks, okay? If you are having any bowel and bladder sign, which means you're losing control of your bowel and bladder, it could be that you literally cannot stand up, you can't walk to the bathroom. And I understand that there are some people that their symptoms are so bad they need surgery now. But if you're not in that boat, it's just really painful or it's just really irritating, can you wait 3 weeks and see what your symptoms do? Could you work with an orthopedic manual physical therapist and see if you could get things moving correctly in order to help your body be able to heal on its own and encourage that healing that your body is capable of doing? It's something to think about. I can definitely tell you with my own eyes, I have seen literally people heal on an operating table. I can tell you in my clinic, I have seen hundreds of patients who are suffering with a herniated or a ruptured disc that has been seen on an MRI who flat out refuse surgery and are looking for a holistic approach to actually heal their body. And we are able to get there. And I know that we have the healing because not only does the pain go away and the movement improve, but they are able to get back to doing the activities that they love without having to worry about this problem coming back. Now, if you're wondering if you need an MRI or if you need to see a doctor for this particular issue, I'm going to encourage you to watch this next video because there are definitely some signs and symptoms that you want to watch out for to see if you need to see a doctor right away. Have a great day, everyone.